IV, fluids and electrolytes. So that is why these patients need hospitalization. But in the normal morning sickness, there is no treatment will not be required. Apart from that, you have to make sure that this nausea moment because of pregnancy, not because sometimes the urinary tract infection in pregnancy, they will not be causing more urinary problems, but more, like patient will present with nausea. Sometimes they are even afebrile, not even running febrile, they just, nausea and vomiting. Similarly, in motor pregnancy and in multiple pregnancy, sometimes this indication when the placental bulk is increased. When the placental bulk increases, then this will be sometimes it is direct. So a normal nausea and vomiting, if the patient is suffering from it will just reassure them. And if at all you have to treat them, then probably the anti-histamine, they are the best antibiotics. You don't have to give them metronidazole and other like ibuprofen. These are not required. Frequency of exudation is because of two things. Number one, there is the increasing weight of the uterus, which is pressing on the bladder, and the capacity, bladder capacity is reduced. Less space for the bladder to expand. Okay. But secondly, the GFR, glomerular filtration rate, will be increased in pregnancy because of the renal flow, which is more blood is going to the kidney. So the urine production actually is increased in pregnancy. Because of these two reasons, the patient has a desire to pass urine frequently, but fortunately around 12-14 weeks, most of the women they are cured of this symptom. But again, you have to rule out the underlying urinary tract infection, and if there is no urinary tract infection, just ask them to not to take the caffeine content, because caffeine is a sort of diuretic. After tea and coffee, you have to go. And this is very troublesome at night, so you just ask them not to take drink, late night drink, and their night will be much comfortable if they do not drink at night. The second trimester, this is actually a peaceful time for most of the pregnant women. Very little activities going on, but this is the time when most of the patients they start getting some aches and pains here and there, and backache, lower abdominal pain, groin pain, headaches, top pain, and by headaches I do not mean their husband actually headaches. So increased vaginal discharge, again this is a physiological. And Braxton Hicks contraction, these are the normal contractions. Pregnant uterus tend to contract forcefully, and patient can actually feel something, that ये हमारे पेट में जैसे कटी हो जाती है. So they think it's something abnormal. So this is just a reassurance. But some patients that can be quite uncomfortable. Similarly, fetal movements quickly. This is a healthy sign. If baby is moving and quickly is kicking against the wall of the mother. So this is a healthy sign. It has to be there. But sometimes the patient they are fighter, and they claim come for the complaint that the baby is overkicking. So this is just a reassurance. Nothing much has to. But for the pain packet, which is most of the time this is because of the relaxation of the ligament, because of the pregnancy hormone. So in pregnancy, this is very interesting. In women, you have a sort of curve in the vertical column. Okay. So there is a line of gravity. So when the uterus, there is a weight of the fetus anteriorly. So to compensate that, the woman has to take a posture like this. Okay. So this curve has to be exaggerated in pregnancy. So that will put a lot of strain on the back ligaments. And this is very uncomfortable in many hands. And that is especially so when they use, they stand for a longer period of time, or they use long heat, then this curve will go, they have to stabilize themselves. If they have to over-flex their vertical column. So this is a posture problem for most of the patients. So for posture problem, you ask them to take proper posture. They have to sit on a chair with a like straight back, and they have the right prolonged standing. They should not wear high heels, and they should avoid lifting the weight, excessive weight. And with all these, sometimes you have to ask them to take a massage, hot bath, massage, hot bath, all these things like that. But if at all if not, then you can use the simple analgesics that we tried. Third trimester, breathlessness, this is because of the weight, baby is not growing, it's putting a lot of pressure on the diaphragm, and diaphragm exertion is less. So most of the women, they will close the If this is a positional problem, you have to ask the patient not to lie straight. She has to use 2 or 3 pillows, maybe propped up, and with that posture, the breathlessness may disappear if you are with the patient. Sciatica, this is again because of the relaxing effect of the, and it can disappear, but it may have to be treated medically, but no surgical treatment should be given to a sciatica patient because it may be a temporary in pregnancy. So if it persists after pregnancy, then this patient will need a neurosurgical opinion, but not in pregnancy. Sleepiness and insomnia, most of the time this is because of not a physical problem, but because of the anxiety. And that tends to be that if a woman reaches near term and time of labor now, most of these women, they develop this. This should not be treated with any drug because that may cause dependence in the patient. Itchy common and splash mark and rashes, they are again common, and most of the time general craziness and movement they will work. If you have to treat them, again you can use the antihistamine and they can make them itch free. Varicose vein and hemorrhoid, again very common, these are because of pressure. Okay. They become manifest in pregnancy and disappear after pregnancy. So no active surgical treatment should be offered. This is just symptomatic. The hemorrhoids are more actually problematic, so that patient should not make her constipation free. Okay. And if you have to use something local anti-hemorrhoic, then you can are safe in pregnancy. The numbness of the hands, this is again because of the pressure on the median nerve, and this is problematic, but you have to give them so that rest there is a pad which will be used for median nerve, then they are very effective in this patient. And local massage and all that can also help. Urinary incontinence, unfortunately, is very common. This is again because of the relaxing effect of the progesterone on the urethro like an angle. But it could also be because of the pressure of the it's a very annoying type. Sometimes actually women have to wear a pad, a big pad for this. But this is again you have to tell them that this is a transitory problem. Reassurance only, no surgical treatment, no medical treatment should be offered. Only the patient should have evacuate our bladder more frequently, and that only what to the patient. Weight gain, if the patient is not gaining weight, this is a more cause for concern. Weight gain itself is not a problem, but sometimes like I said, the women tend to overeat and they grow a lot of weight, and that will not go away after pregnancy. They will stay there because they will not take any postnatal exercises. They will not try to shed the, in other countries, the women actually have a postnatal program to shed the pregnancy weight, residual weight. But so this is a time if you think the woman is eating more and is gaining more weight, around up to 20 to 22 kg pound of the weight, or 10 kg of the weight is desirable. That should be there in pregnancy. If your patient has not achieved about around 10 kg throughout their pregnancy, then probably this is abnormal. This much weight is required. But anything more than that, that should be discouraged. Okay, but no active treatment for weight loss and need. You should not put your patient on the weight. You should ask them to control their diet. Right?